restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I'm going to walk you through this patient's case. It's a really nice case. It's a patient of Asian descent who we worked on with her acne originally, and then we started working on her scars. You can see a really nice improvement just in a matter of a few months here. So I'll go through this case. It's nice because this is sort of more like the bread and butter type of case that we do. Really, you see a lot more complex scars, also sometimes like deeper scars. But in this case, this is a patient with boxcar scars, ice pick scars, and that's like very, very common for us. And on top of this, she had a lot of oil production originally. So actually, I'll show this image a little bit larger for you so you can see it a little bit bigger first, and then let's see if that'll help. You can kind of see it a little bit better, hopefully. Let me know if you can't see it, and I'll try to see if I can adjust it here. But for those just joining, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, and let me fix the mic here. Actually, there we go. Okay, so hopefully you guys can hear me better now. I am Dr. Qazi, a skin restoration specialist in Newport Beach, California, and I focus mostly on acne and scars and pigmentation. So I'm going to walk you through how I did this case over here. It's really, really nice because this is a patient who had oil production, had acne, and then we worked on her scars. And you can see, look at this, really, really great clearance of her scars. Really, there's a few different factors over here, so I'll explain that in just a few moments here. Please sing a song. I can't sing too well, so I'll skip that for now. One time I sang Happy Birthday on here, but other than that, I can't really sing too well. So I'll wait for a few more people to join, but for those asking, how do I make an appointment for you with you? You could do it through my page at drqazi.com. We could be able to help you out that way, actually. drqazi.com, just right there. All of our prices there are there as well. And you could just really schedule a virtual consultation. We have different steps really to schedule that consultation. Really, it's pretty easy. Once you get the email, you'll be able to send over some information with like your photos, especially like just multiple different angles. We'll show you how to do that as well. And it's pretty awesome actually, because most of our patients come from out of state, and we're able to do these treatments really, really safely. Part of it's because when I do the consultation, I'll circle and like showcase every single step of the way, what kind of scars you have and how we're going to work on it. Do you work on melanin skin? Yeah, absolutely I do. I do a lot with that. Most of our patients are actually darker skin type. So most patients are Fitzpatrick 4 and above, probably closer to 90% at this point of Fitzpatrick 4 and above. And so yes, we absolutely do that. What was done for this patient? This patient, we did a Accure laser to help with her oil production, and then we subsequently did TCA Cross. We did as well some laser resurfacing, and then we also ended up doing for this patient a little bit of Bellafill as well. We had to do a few times with the TCA Cross because really these are boxcar scars, and it takes several steps really a lot of times to improve that. Oh, how's it going on? Rio saying, can you use biostimulators to treat necklace lines? I heard Sculptra has high risk of nodules on that area. Yeah, you're absolutely correct that Sculptra is not a good idea in the neck. Instead, better options actually are probably going to be more along the lines like Radiesse. Radiesse can work really well, or just even traditional hyaluronic acid filler. So neck, really popular actually, especially like the tech neck issue. A lot of people complain about tech neck, and it's something that like kind of everybody's like now like seeing because of the phones. Really, you're just like bending forward a little bit there, getting this crease in your neck, and doing something like dilute Radiesse could help a ton. Can you do Bellafill in the temple? Yeah, absolutely. I showed actually yesterday a really good case of a patient that we did Bellafill just in the temples there, and it worked out really, really well. How's it going, Neme? Good seeing you on. Thanks for coming on. Let's see here. Valsi is saying, hi, I've been coming across your page and work, and I'm impressed. Thank you so much. What kind of conditions are you interested in right there? Does cold water help acne scars? It's not something that it's really, that it's going to help per se, but it's actually interesting. I'm going to go on a little tangent with this, but really with water, especially in our area, Orange County, it's like a lot of it is like very heavy. Actually, there's a lot of minerals in there, and that's really important for multiple different factors, but especially when it comes to our treatments, when we're doing these scar treatments, I find that there could be a little bit more inflammation for some patients. So a lot of times I tell them to change over to bottled water, distilled water, and a lot of times that does help reduce some of that inflammation. And when there's that kind of inflammation, it could delay the collagen response, could delay wound healing too. So water actually is a huge thing. You guys should really look and see really just the kind of minerals that are in your water. Pay attention to it. I think it's really worth double checking. I ended up getting some like a water softener, but I still find it almost like a little bit too. I feel like there's still too many minerals in there. And it's kind of interesting actually, because if you go through it, you'll see like different parts of the country have like higher concentration of minerals, and it's possible that sometimes people get delayed collagen because of that water that they're putting on their face, or like just more inflammation. And then it makes you wonder, is it also related to rosacea, like just otherwise inflammation on the face too? So water really is interesting actually, because there's not many studies about it. There's a lot of things that people kind of sidestep and act like it doesn't affect us, but it makes a lot of sense when you think about it. Like you're putting all this inflammatory like in water, splashing it on your face. It's possible that it's irritating the skin so much that you delay your wound healing, delay your collagen response. Oh, hi, Mrs. Jones. How's it going? And NB saying, I bought a Swiss filter for my shower head. Yeah, that's something to pay attention to. Just take a look at those. There's somebody that I was talking to, even just today, actually came in my mind today too, that she was talking about how her company is like something involved with like Japan, like a Japanese water filter type of company. I'm not sure like the full details about it, but she said it purifies it like at a very, very high level. And so something I'm going to take a look and see, maybe there's a way that we could get patients to have less inflammation after they do these treatments because their water quality is better. T. June is saying, I have ice pick scars and noticed TCA Cross help, but it takes so long for my skin to recover. That's interesting. It shouldn't really take that long of a time for your skin to recover, but it could take a long time to get results from TCA Cross. It's a lot slower process than people may think. TCA Cross is really, really slow. So just so you're aware of that, it's not like a fast process at all. And a lot of times people get impatient with it. It's like multiple times, keep on doing it over and over again. You will get improvement. It's just the process is slower than people may expect. It really is. And so that's one thing I just want to tell everybody. It's not like a straightforward, simple type of thing with TCA Cross. Haley saying, I love your page. I need to come see you. My skin has been through it and I don't know what to do. I did CO2. What's going on with your skin right now? Is it more like more scarred? Is it just that you have some texture right now? What's happening with that? What is the best for post-inflammatory erythema? So easiest things to start with are sunblock to make sure it doesn't get hyperpigmented, so it doesn't get darker. And on top of it, you could start something potentially like azelaic acid. Just 10% azelaic acid a lot of times does help for PIE. But sometimes you may want to do actually a laser that just targets it directly. So just like something like I use is XLV. Other people use V-beam. There's multiple different options, but lasers potentially could be really good options there. What is the percent TCA you use? I use anywhere from 30 to 90% for TCA. It just depends on the depth of the scar. That's something very, very different than you'll hear from a lot of places. There's a lot of people who just don't seem to understand that you can't do the same concentration of acid on each individual type of scar. There's some scars that are deeper that you're going to go a little bit stronger on there. There's some scars that are a little bit wider that you potentially are going to change that concentration on again. And, there's a patient of mine, actually, maybe on here, sometimes comes on, and he was telling me that he did, multiple times a Phenol Cross, and he had just done it like a week or so before he came and did a consultation with me. And they had only done the Phenol Cross, and he said that he knew that that they only did it on 4 or 5 spots. And he had so many boxcar scars and ice pick scars. And this was somebody that always pushes Phenol Cross and says that Phenol Cross is superior. And like, this is like the thing that they've really been pushing. And it's interesting because they really, it seems like that they haven't been changing the concentration of the phenol peel on each individual type of scar. And that's why they're only doing that high concentration in some of the deeper scars. And it's like, afterwards, the aftermath of that was that there's some hypopigmentation in this Fitzpatrick 5 patient there. And yes, it could be temporary, but like that's, problematic. So instead, we could do more spots, just change the concentration. It's just we could do it safely. And sometimes what we could do, more spots, just change the concentration. It's just we could do it safely. And sometimes what we could do is we could go in the inside walls of it to be able to actually contract the tissue. Do you have to neutralize after the TCA application? No, it's automatically neutralized. You don't have to actually neutralize it, which is why it's so difficult for a lot of people to do it right, because what ends up happening is that some people are used to just peels, just sort of like that they could do it haphazardly a bit. They don't have to worry so much about if it goes outside of the area, things like that. But with scars, you have to be super precise, and you could run into a lot of problems if you're doing it in a way that could be like splashing it outside the walls, things like that. And so you can't like just go and like get a rescue and like just like hope for the best with some sort of neutralization here. You got to be really precise with it. There's no other way around it. You have to be really, really careful and precise with it. Could you tell me for boxcar and ice pick scars, is CO2 laser better or radiofrequency microneedling? Well, between those two options, CO2 laser is definitely going to be better for boxcar scars, but realistically, you may need other modalities. It's not going to be like a process of either some sort of energy device like that. You may need something like Bellafill potentially, or you could use like something like TCA Cross. All those could be options there. But it may not even be for boxcar and ice pick scar that you have to do laser. It's not clear to me right there. Let's see. Brandon saying, I'm also on Accutane. Let's talk. I just got started. I do procedures on an Accutane. It just depends on the dose that you're on. And if it's more like a mild dose, depending on your weight, there's a lot of different factors in there, what skin type you are, how aggressive I have to go. But there's a possibility that we could do a lot of treatments while on Accutane. There is. Microneedling and PRP. Will it work? Not so much, really. I didn't do that for these scars. I never show results of microneedling with PRP. So it goes to show, I'm not, there's a lot of people like, I don't know about this particular patient, but there's a lot of people who've done microneedling with PRP that will tell you it didn't help. My patient today, interesting story actually for her, is that she actually hardly had any scars beforehand, just mild, she says a mild texture. And she said that I think she said it was an esthetician who did microneedling on her face, and they dug in so deep that they caused scars that look like acne marks, like boxcar scars on her. Really unfortunate. And then she tried to get it fixed with a dermatologist, and she said that they did it really, really, really aggressively with the laser, the CO2 laser there. She's been waiting. I actually consulted with her 3 years ago, and she's been waiting for 3 years. She's had a lot of different issues going on in life. She came all the way from Houston. And, it's an interesting story because there was a whole process where she tried to do things and she went through a route really where people said, well, why not just do microneedling? Just that should help, blah, blah, blah. And then it made scars. It made boxcar scars for her. Someone dug in too deep. It caused a lot of complications for her. And then she tried to get that fixed with a CO2 laser, and she's Fitzpatrick 4 patient. She also has a bit of melasma as well. And they used high heat, high energy. The dermatologist used high heat, high energy on this Fitzpatrick 4 patient over in Houston. And it ended up causing more actually scarring, some really significant hyperpigmentation as well. And so then she was just like done. And she consulted me like 3 years ago to see how we could fix things. And she ended up saving money. Really took her a while, and like issues with making sure that her kids were health and everything like that were taken care of. And then came in and she's going to get a great result. But it's a sad story actually. There's so many stories like that over and over and over again of people that try to do things right. They try to get it done, and they went to somebody that they could sort of be trusted with it. But then unfortunately, people went too aggressive with their skin, and it's like really, there's ways to solve this. There's ways of doing this, and it's a lot of it's not involving lasers as much as people think. How can I achieve a curing for scars? So it's not that we're going to cure this. Actually, how can I achieve a curing for scars? So it's not that we're going to cure this. Actually, I'll show this even bigger. So although we did do another treatment on when she came in November, I'm sure it's even better now. But basically what we do for some scars like this. So these are boxcar scars. These are ice pick scars. And she even has, you can't really see right here, but you also have a little bit of rolling scars here as well. And there's some volume loss. So basically what we had to do is each of those things we had to solve. So those ice pick scars, those boxcar scars, we put TCA, which is an acid we place directly in the base of the scar to trigger a collagen response. And by the way, this patient is of Asian descent, I believe of Vietnamese origin. And the way we did this is we went right at the base of the scars, triggered a collagen response. And then the thicker parts of the scar, that's where we did a laser, where we actually ended up using a laser called a CO2 laser at the edges of the scar to really start softening up those edges there. That worked out really, really well as well. And then we did some subcision. We did that to break up the scar tissue, the tethered bonds that were pulling down the skin there. And then we also subsequently ended up doing, we did a little bit of Bellafill down the line too. So we did some Bellafill about a month or so afterwards, and we started to put a little bit more TCA in her. So it worked out very, very well for her. Long term, she's going to continue to get better and better results. This is actually an early result. We started this in May, and now I got this photo in November. So it'll still get better, actually. Happy now, going to get better even later on. Is that the best it'll look? It looks great. Just curious. No, I mean, we ended up doing some more TCA this day. I believe a little bit more Bellafill as well. So it's going to look even better the next time I see her. It's just a matter of what people want and, their budget, things like that. But we could continue to work on there. Jasmine saying, I'm in Phoenix, would love to see you. One of my other patients today came from Phoenix too, from Scottsdale area. So I have a lot of people from over there. And actually, surprisingly, interestingly enough, my Phoenix patients are very, very good with sun exposure, actually. They're like sunblock, actually, really interesting enough. It's like, I don't actually have to stress too much, actually. So I'd be happy to help you out with that. Average cost for complete treatment. It depends on what you're trying to achieve, like what actual look you're trying to go for. I would say most people $5,000 to $7,000. But if you're trying to achieve like really closer to like as smooth as possible, then it could cost more. If you have a lot of volume loss, it could cost more. And each time when we do the combination session, the future sessions, then let's say for like lasers or TCA, are 55% off. And so there you go. So that's pretty awesome. That's the policy that we have right now. So essentially, that I make sure that I slam it. We got a really killer result each time. And future sessions, if we have to do more laser, more TCA, we'll have it so it's 55% off there. How can I get insurance to cover acne scar correction? You're going to run into a lot of problems. I don't think that you're going to be able to, really. It's not something that gets covered typically by insurance, although it should, but it's just not something that gets covered. And the way that insurance works is their goal is to just not cover stuff. The whole thing is that it just they don't want to cover stuff. So like that's the whole point of it. Even if you really try really, really hard, to get things covered and like you try to push for it, I personally, if I try to get patients on the right kind of creams, the right kind of antibiotics a lot of times, and insurance will do the right kind of creams, the right kind of antibiotics a lot of times, and insurance will just reject it. And it's like, they'll tell me to go use a different antibiotic. And it's like, why should I use a different antibiotic if that particular one is the best one for this patient with this condition? It doesn't make any sense. And they're ridiculous with it. So good luck trying to get insurance to do it. I hope you could do it. But we do, someone's J3's point is, do we need good credit for payment plans? I don't think all of them check credit, actually. It turns out, I think Shuri doesn't check it. Some of my patients are on here right now. I see a lot of their names here. So if you guys could tell me, I don't think it checks it, actually. It's definitely not like a hard check or something like that. But I don't know. Maybe it's not exactly correct though. But it doesn't seem like it's like a hard check or something like that. And people seem to really like it. Are you familiar with Ehlers-Danlos Syndrome? Yes, absolutely. It's just we have to be really careful. Typically, I wouldn't do like more subcision type cases unless it's more like for localized spots, maybe potentially. And then with lasers, you got to be very, very careful. You don't want to use too much heat, too much energy, because sometimes it could actually end up scarring a little bit different when it's healing. So I've actually had, it's interestingly enough, I do find over the, not my age group, I'm 42 years old, almost 43 now, but like my age group, it wasn't diagnosed as much, but the younger age group now in like the 20s or so, it's been diagnosed pretty well actually. And I'm seeing a lot more patients who are appropriately diagnosed, and really we're still able to do it very safely. Just we have to be careful, of course, with making sure we're not using too much heat and using the right tools there. What's the downtime period for Accure laser? There's actually no downtime with Accure. There's no downtime with that. There's no downtime with that. You just could go about your day regularly. Are you doing phenol peels? Is that something you'd recommend for acne scar? I did 2 last week, but there were more severe cases though. One of my patients actually, at some point he comes on. I don't know if you're on right now tonight. He did it. He has very, very, very severe scars, and he suffered a lot. And it was actually I had a whole long talk with him on Friday, because it was just us two at nighttime. It was actually, I was doing the second step, going to do the second step of the phenol peel, going to do dermabrasion for him, where I manually sand it down after we do the phenol. And he was just very, very anxious, and we were just talking about it. And he just has it was tough, and he said that I could talk about his story a bit at some point. So I'll go through a little bit, but it's interesting though, because, he's somebody who really had done 7 sessions of subcision, and I did subcision on him in a single time, and there was so much scar tissue that was still stuck in there. And, I did that about a month or so ago. And then he also had done about 10 sessions of CO2 laser, and there was so much scarring, and nobody was doing volume replacement. Nobody was doing anything else. It's really unfortunate. It's a really sad story. And then, he was talking about how really he was dealing with so many microaggressions and dealing with like just bullying, and it was just like so traumatic for him over and over and over again. And it's like one of my patients today, he's like, the reality is that the acne was terrible, but the scars were like so much worse. The scars were just like something that just like lives with it. It was just feeling so insecure with the scars. The acne was like terrible. Like everybody knows, acne was terrible. Sometimes it's really painful, and it's like very, very difficult for a lot of people. But then it's like these scars that people are left with. It could be really, really traumatizing, and people could go about in different pathways with that. So it's like, honestly, it's a privilege. So it's an actual privilege with the right patients when you like can solve things for them and get them across where like something where they feel more comfortable, more confident in their skin, and when they're looking at themselves in the mirror. And it's like now their whole trajectory in life has shifted. They were going to potentially go about life one way, and potentially, it could have been like with all these microaggressions that they were visualizing and seeing, and like their interpersonal relationships were being affected. Just their mood was being affected every time they were seeing them in the mirror. And now you shifted really like a timeline for them, which is really actually pretty amazing. Actually, it's a pretty amazing feeling. And it's like you almost could feel that in real time when you break up scar tissue, like actually like feel it. That like this was like 2 of my patients today. These were big chunked, like these cystic lesions had destroyed so much fat, and it was so stuck like that. And it's like, imagine just breaking up that scar tissue. It is like a relief for me. It's a relief for the patient, actually. It's like they know exactly what I just did. I just broke up something that was like literally just stuck there for so long. And it is pretty interesting to be able to then see like where this goes then for them. It's a good feeling. It's a really nice feeling. And there's some people that really, it's like, it's amazing to be able to have that, like where we could go down this route now and shift their entire trajectory in life. And you catch them in the right moment, and it could happen. Sometimes people like, it affects them because other things are affecting them. Other external factors are there. And now it's like scars have made caused more anxiety for them and more depression for them. And it's really, really difficult then to kind of get out of that, because it's just sort of like difficult now to really now change their goal to life. So sometimes I say kind of solve some of those other issues. Let's say, for example, like for one of my patients, she was explaining that like her son has spina bifida, and they have to do all those treatments. Of course, like you put that as a priority, and then eventually take care of yourself. When you're ready to take care of yourself, do it. And it's like, it's going to be amazing. And it's going to be an amazing feeling. Like when that ultimately happens, it's like, okay, now you're in the right space. But like, if you're like also still have this other external stuff out there, it's really, really difficult, because the journey for these treatments is not like a straight linear line for a lot of people. You know, it's like sometimes it's like you see this swelling and it's like awesome and it's like exciting. And it's like, man, I like this doctor is the greatest doctor of all time. He solved my scars. Like you feel like that in 2 weeks. It's like, man, this is like the best. This is better than I ever expected. This swelling looks like it's real. This is my thing. And it's actually, it could crush people because then they start to see that, oh, wait, there was that volume loss here, but I just don't understand. You know, it's confusing because at one point it was good and now it's this, and you go through this whole emotional roller coaster here, and it's like people go through that. So you have to have like really, you have to be pretty strong to go through that whole journey. It's really difficult. And then eventually it starts to get really, really good. And if you're in the right space, in the right frame of mind, it's like amazing now at this point. Now it's like your life is just like at a different level now, which is awesome. And it's like, we got there, and it's just a matter sometimes of time. Sometimes it's just like time. It's like a year and a half sometimes. Bro, when are you going to get my Bellafill done? Let me know. Buki, when is that? I can't remember what was going on with the Bellafill there. Let's see. Can you talk about the healing timeline? So yeah, most of the healing process is within the first 4 to 7 days, but there's still going to be some residual redness, especially if you're an Asian patient like this patient. It could last about a year. It could last about a month for a lot of patients. Sometimes it could last even longer, depending on how aggressive, how thick your skin is, what's happening with it exactly. It's possible. But most patients, though, it's really about those 4 to 7 days. And if you follow along my treatment pathway for afterwards, then we really won't run into problems. I'll tell you, really, it's so incredibly rare for people to still have problems. And if you talk to them, they'll tell you that they weren't using the creams that I told them to do. They were adding other things that they were not supposed to do. They were vaping sometimes. They're smoking, vaping, doing things like that. And it's like, you know, that's going to delay your wound healing. You know, I also tell patients, there's some people that will notice that after they do these treatments, their skin gets more oily. It's oily because your skin is very, very dry. But I had a patient who then lied to a dermatologist who was near them, and they went and got Accutane placed on them. They said that they didn't do laser for several months, blah, 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 and they got Accutane too soon, and it dried their skin. You know, and it's like, I just tried to know initially like this, it's not a great idea because you're not managing your oil production properly. And so it's like, you know, sometimes you got to look at these things and think to yourself that like, it's tough for me because I try to weed things out, but then, you know, occasionally it goes through there. You look at people in the eye, they tell you one thing, and here they are, and they'll lie sometimes about the vaping or smoking and then doing things like that. And it's like, man, if you do this in the right mindset, we could get killer results. So just like you came, you did this stuff, you invested all this and then the journey in this, let's do it properly from like start to finish, and I'll take care of it from start to finish. That's the best part about this. Actually, you know, there's a lot of people out there that do these kind of treatments and they don't even do these treatments. There's a doctor over here who doesn't even do the subcision on the left side because he says he can't use his left hand, and he has like someone else like do the left sided subcision. So, you know, what can I say? You know, like there's a lot of things like that out there, and it's like, I will do this and I will run through a wall to make sure we could get this done right, but we could do it, and it's pretty satisfying when you get there. And you could be another person on here that's like super happy with us, and we could get there. Chantal MD, how's it going, Chantal? Dr. Chantella is saying patients are not compliant no matter how much you explain about simple things, suggestions, sunscreens they do not follow. They do not understand that they are non-compliant. It is the saddest thing. I will say that is extremely, extremely rare. Extremely rare. It is so rare that like it's literally like those like 2-3 people sometimes that I'll talk about. Like it's like so rare. So it's actually pretty exciting actually when you actually think about it. So it's like I can never let myself get jaded at all ever, because it's like when you actually look at it in the grand scheme of things, people just want to improve like their quality of life. They want to look at this and they want to feel better about themselves. They want to look at things like they can feel more comfortable and confident. And every time that they look at themselves when they wake up in the morning, they just want to feel happier. They don't want something like that to bring them down. And what happens for some people with scars is that everything's going well in life. You wake up, you had a good dream, and then like you go to the washroom, and potentially like now like a light is out, and now it looks like a little bit more like angled lighting now on you. And now it's like, man, is that what I look like? Is that what the scar looks like now? Is that actually me, real life? Or like at the end of the day, like you decide to go to the shopping mall and you go to the changing room, and then like these changing rooms are just like terrible. And it's like, man, this is terrible. But I will say, I was actually at the gym the other day, And it was actually, I took a photo. I was going to put it up. I didn't get a chance. I was going to put it up over on, put it up on social media, because it's actually kind of interesting. I was looking at it. It was like terrible overhead lighting in the elevator. And it was like really for the first time in my life, literally, I kid you not, the first time in my life, I was looking at myself in the mirror and I was like, man, I actually don't really see the scars in this overhead lighting. That's pretty cool actually for me, because I always sort of accepted. I was like, this is like very, very minimal, like very, very minimal. I mean, I'm like older now. It's like took a long time to get there, but it's a pretty cool. I was like thinking to myself, that's a pretty good feeling actually, that I don't have to stress as much about that. And I really want people to feel that way. I really, really want people to have that one day where they could look at something and be like, when they're looking at the mirror, like, hey, this is really like pretty good. This is not like a bad situation here. Like, I'm actually here now. That moment that happened, like, I'm here. Thank you, Vanita. It took, it's interesting. I have so many people that say that, about that skin, like, what do you do for your skin? And imagine me when I was like in high school and I had like some of the worst skin in my class, like some of the worst skin. And so it's pretty cool actually to be able to have that feeling where it's like, people are saying that, and patients will ask me, where are your scars? I don't see any scars. And like, you have to really, really point something out there. And it's pretty interesting, really. Like, it's like, you really do wish you could go back in time and like tell your mind, like back in 16 years old, when you're sitting there, and worried about your skin and worried about what's going to happen. Like I was actually worried even at that age about permanent scarring and things like that. And I was like, man, imagine if I could tell myself that at some point it's going to feel really good. It's going to, you're going to look at yourself even under angle lighting and like be happy with it. And it's like, wow, you could get there. And like, you wouldn't even believe it. I wouldn't believe it unless myself told me that. Actually, my dad, my parents told me like, oh, it's going to be fine. It's going to be fine. But I thought they were saying that. So it's like, it's one day. I hope everybody can feel that way. I really do. That's why this is all open source. I told you guys could, like, I showcase how I do things. I do it all because I want to actually have that. I want to have people learn how to do and learn what to do, learn how to do this at a very, very high level. I want that. I want this, I want these dinosaurs, these people that were gatekeeping, these people that are basically shoving things down people's throats about things like microneedling and Fraxel and all that stuff. And I want them just to go. I want those people that were just having forcing skincare lines on people and selling $2,000, $3,000 worth of skincare products on people. I just want them out. They're gone. In my mind, they're just done. And I don't care if it views as oh, this is unprofessional to them. It doesn't matter. They're unprofessional. They were unprofessional to me when I was sitting there in your shoes and I was like an acne scar patient. I just felt that they were very unprofessional to me. Many of these people were just nickeling and diming me, and they were just tricking me and trying to get me to sign up for, I'm going there for Sculptra or something like that. And they're trying to get me to do Botox, trying to get me to do all sorts of random stuff. And it's I didn't like any of that. And so it's to me, it's all that, just we just need to carve them out. And just the new world is just different now. There's just new rules now. And these new rules, the way that we're going to set things up is that there's going to be certain guidelines. And one of the biggest things is that we're just not going to punch down. One of the big things that people don't really realize is that you could actually separate the world based on the people who punch down. You actually could look at it. You could actually see who are the people that pick on people who are below them and a lower status than them, or whether it's money or anything else. You could actually see that. And you could just start separating them out. You could just carve them out. Just carve them out of society. Because acne scar patients and scar patients in general are some of the most vulnerable patients that people have in front of them. Burn patients, scar patients, very, very vulnerable people. And really, they could be very, very willing to spend a lot of money if you are showcasing results after a week, for example, of just swelling, and it's really, really unfortunate. It's very, very unfortunate to just do that over and over and over again, where you showcase these selfie results just after a week, and then you insist on getting these thousands of dollars worth of skincare products for patients, and that's how you insist that you could get results. You only have to do that. And here I am using CeraVe, Cetaphil, Vanicream, and it's working, and we don't need those things. So it's clearly this old model, this old way of doing things just needs to go. I don't care if that was their business model. It doesn't make a difference to me. I could care less if their business collapses because of these things, because it's it was just an unethical practice. It was unethical. And it was just harming people. It was doing things that just weren't going to be effective enough for this. We could have been such a higher level at this point today. We could have been doing things so well if these guys at that time were doing things properly. I wish they were. I wish it was that like we had people that were showcasing to us over and over how to do things at a very, very high level. Imagine if they could have, we could have been somewhere different. And imagine if people, instead of trying to compete, they try to work on elevating themselves and cooperating and seeing and learning and doing those type of things. Instead, people just want to be competitive. And we ended up just like where people just fight and fight with each other. It's really, really unfortunate. So this world is just, we're shifting it. This is a timeline shift that you're seeing right now. That's what's happening right now. It's a timeline shift. So Andy's saying, hi, Dr. Qazi. I'm excited to start treatments with you this month coming in from Chicago. Awesome, Andy. Go look. I think, when do we do our consultation? Your name sounds super familiar from Chicago, but I've had a few Chicago patients. I just want to double check. When do we do that consultation again? Then I'll remember that. Jasmine saying, I have bumps on my nose that I got from picking at it in high school. Would there be something that make them go away? Yeah, laser, CO2 laser. We could actually use that to smooth down those bumps at really precisely, like each individual spot. Triple X is saying, can you explain how electric shavers cause acne scarring? A lot of times it's more of hypertrophic scarring because of the friction that happens. In fact, my patient today, they did a consultation to me from Idaho, actually. And what ended up happening is that he was using an electric razor and he ended up getting keloids along the jawline there. It's something I see a lot of times with a lot of men. I'll show you, actually, I didn't have time, I've just been pretty busy, but at some point I'll show you some videos or some photos of just what I do for shaving, actually, and what I would recommend for acne patients. You could actually just use Cetaphil Gentle Cleanser to shave, actually, and then use, I always forgot what's Fusion, like 5 or 6, I don't remember how many blades it has, but just like Fusion 5, or just use a straight blade and don't use electric razors. Don't use them anymore. There's too much friction, and that friction could end up causing it to get inflamed there. So Macha, good seeing you on too. You're coming tomorrow? Awesome. I'll see you tomorrow then for your follow-up then. UAE saying, why do you only have before and after photo and don't make before and after videos? I have so many videos. I have so many before and after videos. I'm not sure what you're referring to. Let's see. Anuka saying, Doc, how much would it cost per session to treat acne scars for an international student? Well, it's tough to say, but most patients spend about $5,000 to $7,000 on their scars. It depends on how deep and thick the scars are, though. Some people, it could be less than that if it's not as severe, but a lot of times it's $5,000 to $7,000 for their treatments. What treatment was done for the patient above? So this was with TCA Cross. This was with, so I did a few things here. So we did TCA Cross. We did ablative CO2 laser at the edges of the scar. We did also subcision. We did fractionated erbium laser as well. And then we did some Bellafill. And then we did a few steps of some more TCA Cross for this patient. So we did a few times of TCA Cross. And this was from May until November right here. Let's see. Accure is saying, what's the best treatment for static depressed frown lines aside from filler? CO2 or RFM? Well, I definitely would say that volume is going to be important for something like that. So you really need to do that. A volume replacement is really important. So I know you don't want to do fillers, but maybe think of biostimulatory products like Sculptra, Bellafill. I'm assuming are you talking frown lines? Which ones? Are you talking about right over here? Then in this case, then you want to do Botox, freeze the area there. You could do subcision. And then you could also do a little bit of laser there. You're right. And sometimes if there's some volume loss, as long as it's frozen, you could do like a hyaluronic acid filler. If you're talking about more like nasolabial folds, marionette area, then that could be something that you could do some filler in there, like Bellafill, Sculptra, all good options there. But I wouldn't do Sculptra right over here, by the way. Sierra Dickinson saying, what's a different percentage of TCA for Cross and how do you decide? When do you choose to use Phenol Cross over TCA Cross? Sorry if this was already answered. So I use like 30 to 90% of TCA usually, and it depends on the depth of the scar, the width of the scar. There's a few different factors that are involved there. Phenol Cross I use when I do the phenol peel. The next day I do the cross form of it. So I usually use it for that. And then I also do it for patients that they really request it. But I don't see really any utility in doing phenol over TCA. And I personally just use TCA because we could just change the concentration. The pharmacy that I use just has a perfect concentration for me. So I just adjust it as I need to. How bad is the swelling following Bellafill? It's pretty mild. I mean, there's a little bit of swelling. It's pretty mild, though. You're not going to be too bad. It's so much up. Is the Philips one-blade electric razor good for shaving? I wouldn't use any electric shaver, XXX. None. Is it best to correct acne scars before a facelift? It could be, yeah. Depending on what you're trying to achieve, it could be a great option because we could help with the texture undermine some of the scar tissue, which isn't necessarily done with most facelifts. And on top of it, actually, usually we want to do something with resurfacing there, which is great anyways, because your skin quality is better for the facelift, which is always better. For something like this, how many weeks or months was the process? So we did May to November. She was a local patient. We did do multiple steps of TCA Cross. We kept on doing some TCA, which helped out a lot. Jasmine saying, are video consultations just as effective as in person, considering I'm in Phoenix? Yes, they're totally effective. I'll circle the scars that you have. I'll go through, walk you through exactly how I'll do it. So we absolutely could do that. Can you do Accutane instead of Accure for a patient who has epilepsy? Yeah, there's no issue either way for any of those. So we could absolutely do either option. I just want to manage patients that they don't have severe acne or moderate to severe acne. I want the oil production under control when you do the scars. I want you to not have scars due to your acne. So absolutely could. I bought a consultation last year. I have not booked it. Do they expire? I believe you have 1 year to do it, so you better book it now. So I believe it's just 1 year. I think that's there. What's the purpose of the Eucerin pigment cream? Is that after a Accure laser? I do it if I see like little hyperpigmented areas. So I do that for just a little hyperpigmentation. It's a good cream just for that. Please open an office in New York City. I'm really happy for where I'm at right here. Our team is great for us, and we're right by the airport. So I doubt I'll be anywhere else like that. People come all over. It's just like, it's very, very easy for us to be able to make sure that it's just done very, very safely over and over there. So I'll sign off for today. Ganesh is asking one last thing. He's saying he's been asking multiple times. Let's see, Ganesh. I don't know, Ganesh. I can't find your question here. Okay. If you scroll all the way up. Okay. So can tretinoin cream make medium scars better, and can it improve the skin texture? Yes, it could help with the skin texture, mildly improve some of the scars by reducing the diameter of the scars a little bit. Not going to help too much though for most though. All right, guys, I appreciate everybody. I will be back on tomorrow night. So I'm glad I'm back on all the platforms again. At least it seems like it. I think there may be one or two that's still messed up, but I'm glad I'm back. So thank you guys. Thanks so much for joining and being patient for us. And hopefully there's no other problems in the future.